Okay. Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with my co-instructor. This is Bodhi, and he is 2 months old. And we are working on our torticollis series. Bodhi does not have torticollis, but we're pretending like he has a right-sided torticollis. That means his right sternocleidomastoid, this muscle right here, is tight. That makes you tilt your head to the right and rotate to the left. And so you need to work on activities that make him do the opposite. So we're working on the cervical stretches into rotation. For him, since we're pretending he has a right-sided torticollis, we need to work on him turning his head to the right, which is toward the camera. So one of the things parents tell me is these stretches are really hard to do. So one of the ways that you can do it, is put them on their right side and then slowly try to take their body and rotate their body to the opposite direction while you're keeping them this way. Oh. So if you start off on the side, hi. You want that or not? There you go. And then I've had some kids, Bodhi went pretty easily, but some kids this is really hard. So I just kind of have to jostle them and rock them and try to get them back the other direction. You can see for Bodhi, this isn't that hard. Oh, maybe a little. Oh. So let's go back and try it one more time on the side. And bringing him back. Oh. That's an excellent example of someone who might not like that stretch. Thank you, Bodhi. So there's no consensus on how long you should hold these stretches, but there is just general consensus that more frequent is better. I recommend people work on some of these stretches each time that the child is awake when they have torticollis. Thank you for keeping your head that direction. I hope this is helpful for you, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. Like this video and would like to be notified by email when the next video comes out? Click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.